So some reasons for these baseline assessments and why they're really important is for the breast cancer population, it helps to have us provide some baseline data on your range of motion, on your strength, on what you used to do before, what you want to get back to doing, as well as girth measurements for your arms so that we have somewhere we can start and follow those measurements throughout your treatment to make sure that your lymphatic system and all your other systems are really healing the way that they should be. We also screen for physical and other functional impairments to make sure that we are addressing all of those in a timely need. This is really a great opportunity to receive education about all of the cancer care people on your team. You get to meet the therapists, you get to meet anybody on your team that is important in your care, currently and then post-surgically as well. So let's talk a little bit about when it's important to get into rehabilitation post-surgery. In general, we recommend that patients return to cancer rehabilitation specialists 2 weeks after their surgery, again, following surgeon's orders and guidelines based on their specific surgical procedure. But we want to see patients back in phase 2, where we have the most impact on their recovery and the ability to really help facilitate healing for these body systems that have been disrupted. So one of the things that the cancer rehabilitation therapists do is really follow the phases of healing. And the phases of healing are the same, whether you're having surgery to remove cancer or a rotator cuff surgery or back surgery. And it really consists of 3 phases: the inflammatory stage, the proliferation phase, and the remodeling phase. And these phases start from right after surgery, the inflammatory stage, and goes for days, and then goes through the proliferation stage into the remodeling stage over the next period of months. And the important thing to know about the phases of healing is that as therapists, we are aware of these protocols that the doctors are sending us in regards to your specific surgery or your specific reconstructive protocols, so that we're protecting those healing structures. And the other important point is that rehabilitation really has a strong impact during the proliferation phase, because this is the phase where scar tissue is just starting to lay down, but it still has the ability to be remodeled and formed. Once you get into the remodeling phase, that scar tissue is laying down pretty strongly. Those collagen fibers are really laying down strongly, so it's a little bit more difficult to really affect and mold the tissue the way that we want to. So for somebody going through breast cancer and breast cancer surgery, my take-home message to you is, if you feel like something just isn't right and you don't feel right, just say something. You have a whole team within our institutions that have amazing resources to take care of you, to help improve your quality of life and get back to that life as soon as possible. For healthcare providers, we have more and more survivors every day, and there are going to be over 20 million by the year 2026. We need cancer rehabilitation specialists and competent team members to take care of people, not only breast cancer, but all of our cancers. So please make sure that you are competent and go through the required education in order to really have a full understanding of the complexity of cancer and taking care of people that are going through that.